So scleroderma and systemic sclerosis are often used interchangeably. Scleroderma actually comes in two varieties: localized, which means there's just an area of involvement on the skin, but no internal organ involvement, and systemic sclerosis, which means that there's skin involvement plus internal organ involvement. And sclero means thickening, and derma is the skin. So one of the most hallmark features in scleroderma or systemic sclerosis is thickening of the skin. Although not everybody has that. They might have more subtle skin involvements, but a lot of internal organ involvements. Or some people have a lot of skin involvement and some might have just a very little bit. So systemic sclerosis can actually be further divided into limited systemic sclerosis. And what that means is the skin involvement is below the elbows, below the knees, can involve the neck and the face. That's limited systemic sclerosis. So you can still have internal organ involvement, but you just don't have quite as much skin involvement as someone with diffuse systemic sclerosis. Diffuse, there's more skin involvement. So now it can be above the knees, above the elbows, and on the trunk. And then there's one other very rare category of scleroderma called systemic sclerosis sine scleroderma, meaning there is no skin involvement, but the very characteristic internal organ involvement. So those are the three main types of scleroderma, systemic sclerosis. And then sometimes these rheumatologic diseases go in pairs. So sometimes people can have scleroderma and they can also have rheumatoid arthritis or a little bit of lupus. So there can be an overlap. So in addition to skin involvement, other very common findings in scleroderma or features of scleroderma include something called Raynaud's phenomenon. Often that is one of the very first symptoms of scleroderma, where the fingers can turn colors when they get cold or sometimes when there's vibration. And so patients will describe that their fingers turn blue or white, and then when they warm up, they're red. Sometimes this can be quite painful. Sometimes it can be associated with digital ulcers or ulcers on the fingertips. And that can often precede the skin changes. Patients with scleroderma often almost uniformly have some esophageal involvement, or patients have a lot of indigestion or acid reflux, sometimes trouble swallowing, so a lot of esophageal involvement. And then the organs we worry about that can cause, cause troublesome symptoms and can shorten lifespan are the lungs, and the lungs can be affected primarily two different ways. One is with interstitial lung disease, which means inflammation and scarring in the lungs. Some people use the word pulmonary fibrosis, but it's inflammation and scarring in the lungs. And the other is pulmonary hypertension, which means high blood pressure in the lungs. And people used to get into trouble with severe kidney disease. They used to have something, they still have something called scleroderma renal crises. But fortunately, we have a class of medication called ACE inhibitors that can very effectively treat scleroderma renal crisis. So when we go back to thinking of our diffuse scleroderma and our limited scleroderma, often we think that the diffuse scleroderma patients are more likely to have interstitial lung disease, and the limited scleroderma patients are more likely to have pulmonary hypertension when it comes to the lungs. But in fact, both categories of scleroderma can have interstitial lung disease, and both can have pulmonary hypertension. So it's very important in scleroderma that we are screening, at least yearly for the presence of interstitial lung disease and pulmonary hypertension in all our scleroderma patients.